My name is Kelsey SHEA, and myself and Cathie Moran are going to speak to you today about our research project entitled Indigenous Mentorship Program for Indigenous Undergraduate Students Pursuing Medicine, a pilot study. Like many individuals, Indigenous undergraduate students considering medicine as a career may feel uncertain or lack confidence regarding the application process and may benefit from support or mentorship. The purpose of this study was to gain insight into the experiences of Indigenous undergraduate students considering a career in medicine as they participated in an Indigenous mentorship program. The program was designed to assist students prior to applying to medical school. More specifically, the aim of this project was to determine if the mentorship helped to increase awareness of medicine as a career option, impacted self-perceived knowledge, confidence, stress and anxiety levels, and preparedness regarding applying to medical school, as well as overall utility of the program. Furthermore, it sought to identify barriers and enablers to implementing and maintaining such a mentorship program. This research project had 10 participants, 6 of which were mentees, and all were undergraduate students at the University of Ottawa, as well as 4 mentors, who included Indigenous medical students, medical residents, and staff physicians. The mentorship program itself consisted of one-to-one mentee and mentor pairing, 6 group sessions, and baseline and follow-up surveys were conducted. Demographic information and surveys were analyzed using descriptive statistics and thematic analysis. The results of this study demonstrate that of the 6 mentees, 3 reported interacting with their mentor between 1 and 4 times, 2 interacted 5 to 8 times, 1 interacted 17 to 19 times. With respect to attendance at group sessions, 1 mentee attended all 6 sessions, 3 attended 4, 1 attended 3 sessions, and 1 mentee attended 1 session. The results indicate that the mentorship program helped to increase awareness of medicine as a career option, decrease stress and anxiety levels relating to applying to medical school, and increase self-perceived confidence, knowledge, and preparedness with regards to applying to medical school.
5 out of 6 mentees felt more knowledgeable of what is required for a strong medical school application following participation in the mentorship program. Notably, the individual who did not feel prepared attended only 1 of 6 group sessions. 5 out of 6 mentees felt more prepared to apply to medical school after participating in the mentorship program. Regarding stress and anxiety, 4 out of 6 self-reported less stress and anxiety related to the medical school application following participation. 2 mentees reported no change. Mentees rated how useful they found the mentorship program. 5 out of 6 mentees reported that the program was either very useful or extremely useful.
Identified enablers to programming included interacting with Indigenous mentors at different levels of medical training, convenient locations for group sessions, funding, engaging social activities, strong mentee-mentor relationships, and level of knowledge of mentors with respect to medicine and the application process. Identified barriers to programming included scheduling conflicts, logistical challenges, as well as 1 mentee and 2 mentors identifying poor mentee-mentor relationships as a barrier. Participants reported that including teaching on traditional Indigenous medicine and more group sessions would enhance programming. Furthermore, it was suggested that an initial meeting explaining the intention of the program, providing more opportunities for group socials, as well as facilitating mentor-mentee meetings and regular check-ins with mentors and mentees would be beneficial.
We had some quotes from the mentees. One quote said, "I really loved being able to meet all the Indigenous mentors and talk about their lives. It made me feel like anything was possible and that medicine is possible. I thought it was a great experience and I am extremely grateful to have met such powerful and motivating people. I would love it if the program continues." The results of this study suggest that an Indigenous mentorship program for Indigenous undergraduate students considering applying to medical school is perceived as beneficial by mentee participants. Given the lack of Indigenous representation in the field of medicine and the fact that mentorship programs have been shown to increase the number of applications to medical school from underrepresented groups, it is crucial to provide mentorship opportunities to Indigenous undergraduate students. This has the potential to increase the number of Indigenous peoples in the field of medicine, as well as positively impact patient care because Indigenous healthcare providers have been shown to be better equipped to provide more culturally competent care to Indigenous individuals and communities. Future mentorship programs may seek to incorporate traditional Indigenous medicine teachings, facilitate mentor-mentee meetings and check-ins, as well as collect data and conduct research for the purpose of program improvement. We would like to respectfully acknowledge and pay respect to the Algonquin people, who are the traditional guardians of the land on which this research project took place. We would also like to thank the University of Ottawa Indigenous Affairs Office and the Indigenous Resource Centre for providing a culturally safe space for the group sessions and sending out recruitment emails to the undergraduate students. We would also like to thank Dr. Darlene Kitty for her mentorship and guidance with this project, as well as Lisa Abel for her tireless work, organizational skills, and multiple food runs for our group session. Here is our reference list, and thank you for taking the time to listen to our presentation.